This is the applicator that you will be using to inject Trimix, and for starters we'll show you how to put it together. The first thing we're going to do is attach the head to the front portion of the applicator, and we set this generally when we start at level C. C is in cat, and once it gets set there it's pretty steady. The significance is C will allow just a 1/4 inch of needle to be exposed upon injection, which we find is, again, generally speaking, enough to get into the cavernosum, which is your target, but not more than you will need. Put together, the applicator looks like this. But before we actually attach everything, we want to do a couple things. A, we want to cock the applicator, and so I do that by turning the front portion upside down, pushing back, and locking the black plunger back. The second thing you would need to do, of course, is load the dose. So we would take the pre-filled dose or a dose you had previously filled and drop it needle first into the front portion like this. Then take the back portion, twist it together, and now the applicator is ready to use. Okay, now let's talk a little bit about the application itself. So for starters, there's a built-in safety. If you look closely, there's a exposed red line right there. So you would need to actually have this depressed enough to cover up that red, and then you would be ready for injection. It would allow you to actually press that button at that point. It doesn't require a lot of pressure, just a little bit to close that gap down, and you're good to go. Okay, before we actually do any injection, you want to go ahead and make sure that the location that you're going to be injecting is sterile. We use an alcohol wipe for that. Just go ahead and hit it briefly there. Make sure it's dry, and then you can go ahead and go forward with the injection. Next, when you're lining up your injection spot, you always want to be about a finger's width from the body. So from the base of the abdomen at the base of the penis, you want to be about a finger's width out. So on this model here, you want to be right about there. The thing you want to do when finding this spot, and this model doesn't have too many examples of that, but you want to avoid any obvious veins or blood vessels. So we advise being anywhere from about a 45-degree to 90-degree point. Again, always be flush, avoiding any obvious veins or blood vessels along the way, and then finding that space and lining up the injection. And finally, a last couple of little hints in trying to get a very clean injection. When trying to get your penis exposed, there's a temptation to yank it out away from the body. It's not good to do that. It won't help the injection side. You also, you'd be better off just pushing the skin back around it. So if you have a little bit of a belly, you want to push the skin back, exposing the penis that way. Additionally, as we talked about before, when you're lining that spot up, make sure not to put too much pressure down, flattening out the penis, because in both cases, either stretching the penis out or pressing too hard on the applicator would essentially flatten out your target, which is the cavernosum, and we want that to be full and easiest to hit, which is, again, just lining it up like so. So I just mentioned the cavernosum, and I wanted to give you a quick visual on this. So this is an overhead view where you can see that the two rows here of cavernosum line the entire staff of the penis leading up to the head. This is a frontal view, and you can see that they take up these two rows of the corpus cavernosum. They take up a majority of the penis area. So by dilating, by getting a good injection into either side, both sides will dilate and take in blood to create a successful erection. Ideally, you also want to cup your penis with your non-injection hand, or at least your thumb and forefinger, creating a very stable target and also helping stabilize the applicator itself, like so. Okay, so we're ready for the injection. We have it steadied with our non-injection hand. We have it lined up. We have just enough pressure on the applicator to close the safety gap, and I'm ready to push. Now again, you're pushing straight down like that, or straight into the applicator. So we do that by using our thumb. Once the black rod, as you can see, is depressed, you know that the medication has gone in. You pull it straight away. Okay, demonstrating from the left-hand side, the same thing, just flush at the base of the penis, steadied by my non-injection hand, and click. At this point, it's always a good idea to place your thumb on the injection point with your forefinger on the other side and apply some decent pressure here. It's doing a couple of things. It's making sure that the medication stays in the cavernosum. There is a pressure that's pushing it out, but also it's stopping any superficial bleeding. Again, we mentioned the blood vessels and the veins there. It's so easy to nick one of those. And if you can apply decent pressure, kind of rubbing with the thumb for 30 seconds, maybe a good minute, it'll stop any of that superficial bleeding, which if you allow to go on would show itself as a bruise usually the next day, essentially dried blood underneath that first layer of skin.